To learn more about earning college credits with study hall courses, go to gostudyhall.com or click the link in the description. Did you ever go over to your friend's place as a kid and realize, oh, they do things different here? Like instead of a bowl of gummy bears after school, your friend's dad put out carrot sticks and celery. Or maybe there was no TV after dinner in your place, but your friend's family was all gathered around the TV all night long. Or maybe your house was pet-free, but you lost count of the cats at your friend's apartment, which honestly was a dream scenario that inspired my 8 cats and 3 catios that I built myself. Chances are you felt pretty comfortable with the way things were done in your home and your family. And maybe you felt a little unsettled with the way things went in your friend's home. Things didn't feel quite right. But that doesn't mean there was anything wrong with the way your friend's family did things. Often the way we feel about people and situations has an awful lot to do with what we're used to. And the same is true in psychology. We all experience a range of emotions, behaviors, and thoughts, and we're likely more comfortable with some of those thoughts and emotions than others. The more unsettling feelings aren't necessarily a sign that something's wrong, but sometimes big picture patterns of behavior, thoughts, or emotions can cause problems in a person's life. And it can sometimes be hard to tell whether our feelings are okay or if they're a sign that something more is going on. So psychologists have tools and resources to help us, and that can make us all feel just a little more comfortable. Hi, I'm Deja Fitzgerald, and this is Study Hall, Intro to Psychology. Even with all those tools and resources, it can be hard for psychologists to evaluate behavior because there are so many factors that contribute to whether our thoughts, feelings, and behaviors help us or hold us back. And psychologists consider all those factors when they diagnose psychological disorders. These are mental processes or behavior patterns that cause emotional distress and impair a person's ability to function. But it's tricky. Definitions vary across cultures. Behaviors that are considered harmless in one culture may be pathologized or treated as a psychological disorder in another culture. For example, many cultures have pretty clear ideas about what's expected when it comes to eating. In many places, skipping meals is seen as an unhealthy choice. It could even be viewed as a symptom of a disorder. But in other cultures, the practice of fasting, or going without food for intentional short periods of time, often for religious reasons, is a choice that's met with reverence. People are also just really different from each other. And depending on the person, a certain behavior could be a sign of a problem, or it could be just a personality quirk. So it can be hard to know how to respond when we notice changes in behavior in ourselves or someone we know well. Like, let's look at Edith. She's always been a careful person. She pays attention to what ifs and keeps a plan. And a backup plan, and a backup plan for when the backup plan inevitably fails for her days, weeks, and months in a very detailed planner. These qualities have been helpful for the most part. She sometimes feels overwhelmed by worry and fear, but her family and friends usually tell her that everyone experiences these feelings at times. As Edith starts a new high-pressure job in politics, her detail-oriented work is appreciated and rewarded, but she begins to feel a lot of stress. The sheer amount of what-ifs begin to overwhelm her on a daily basis. Many of Edith's coworkers also appear to be stressed and anxious, but Edith soon begins to experience personal distress. She's sleeping poorly, has racing and upsetting thoughts, like every day she goes to work she might be fired, and has a poor diet, partly due to a lack of appetite and new stomach pain she's been having. Edith is experiencing anxiety, which is becoming maladaptive. Even though her hard work and organizational skills are helpful to others, they actually make her less able to handle her daily life and tasks. So, Edith looks for help from a therapist. When she describes her symptoms, the therapist is able to help Edith see whether her symptoms are typical of her organized personality and high-pressure job, or whether what she's experiencing is something more serious. In the end, the therapist determines that Edith's symptoms are causing her distress, and she's diagnosed with generalized anxiety disorder. The therapist works with Edith to consider treatment options like additional therapy, medication, or changes to her daily habits that will help keep her anxiety from getting in the way of her daily life. For a while, Edith's anxiety disorder was difficult to see because she had always been very cautious and detail-oriented. She had also become anxious in situations before, and a certain amount of stress was expected in her work. There were parts of her personality and work culture that made her behavior understandable, but it soon became clear to Edith and those around her that her behavior was causing distress and disrupting Edith's life. People experience personal distress in many different ways. And since it can be hard to know when behavior becomes maladaptive, psychologists have developed some specific tools and language to help diagnose psychological disorders. These tools help mental health professionals know exactly what to look for so they can tell if behavior is considered healthy within a culture, workplace, family, or individual. The Diagnostic and Statistical Manual of Mental Disorders is a very large book. And while it kind of sounds like the name of some dusty stereo manual that's been in your closet since 1998, it's actually one of the most helpful tools that psychologists use to diagnose psychological disorders. This manual was first released in 1952, and over the years, it's been changed and updated as research and understanding of psychological disorders has changed. In 2022, a revision to the 5th edition, known as DSM-5-TR, was released. That just rolls right off the tongue, but we'll call it the DSM for short. If we were to casually flip through for a little light reading, we'd find that the DSM lists nearly 300 specific mental illnesses, with details on the symptoms that are required to diagnose each one. These mental illnesses are grouped in categories of disorder types to help psychologists organize symptoms and appropriately discern between similar diagnoses. We'd also see information on whether disorders are common or rare, and whether one disorder often occurs with another, which is called comorbidity and is quite common. Like if someone has a substance use disorder, they may also have major depressive disorder. This all helps psychologists evaluate symptoms and recognize patterns in behavior, and work with patients to diagnose and treat disorders. If we wanted to do a really deep dive and look back at old versions of the DSM, we could see how time and culture impact our understanding of disorders. Like in the original DSM-1 and 2, homosexuality was pathologized as a mental health disorder, but it has since been completely removed from the DSM. Good riddance. And the DSM-5 changed language like desired gender to experienced gender, which shows how our understanding of the psychology of gender dysphoria has changed. Other changes to the DSM show how treatments have developed to treat disorders in more specific ways. For example, major depressive disorder is a named disorder within the DSM, but in 1987, the DSM-3R added a condition within depression known as major depressive disorder with seasonal pattern. This change acknowledged that some people's depression is connected to seasonal changes, and psychologists may need to use different approaches to specifically treat depression that is associated with the arrival of a specific time of year, like winter. Psychologists are always learning and updating their understanding of disorders and treatments so they can help more people, which is great for people, but not so much for trees. Luckily, we've got digital versions of the DSM-2 because that's a lot of paper. And all the paper and all those books doesn't even really tell us the full story of psychological disorders. The DSM is just one tool mental health professionals use to understand and diagnose psychological disorders. Another way they can understand behavior is through etiology. Etiology is the study of the causes of a disease or condition. And while your favorite TikTokers have plenty of ideas about why you have anxiety, etiological research is ongoing to understand whether some people are predisposed to certain conditions through genetics, or whether they have to do with our upbringing or other experiences, or both. There are at least 5 ways that psychologists answer the question, what causes psychological disorders? Let's think back to Edith. After being diagnosed with generalized anxiety disorder, it may take some time to find the treatment or therapist that works best for her. She might meet with different mental health professionals who have different perspectives on her condition and her past to understand the causes of her anxiety and come up with a treatment plan. First, there's the biological perspective. That means believing there's a physiological cause for psychological conditions. So a psychiatrist who sees anxiety as a chemical imbalance in the brain might prescribe Edith medication to adjust these chemical levels. A psychodynamic perspective, on the other hand, says that disorders come from childhood experiences or unresolved and unconscious conflicts. So Edith might speak with a therapist to uncover unconscious mindsets and memories that might be holding her back from living her best anxiety-free life. Next is the behavioral perspective. It says that maladaptive thoughts and behaviors are learned and can therefore be changed. So a therapist might help Edith talk through events at work and then guide her to practice taking a minute to herself before she gets too overwhelmed or breathing slowly to calm her nervous system. Then there's the cognitive perspective. It basically says that psychological disorders come from faulty thinking and distorted perception. So in treatment, Edith might be asked to challenge her anxious thoughts. She may repeat the phrase, "Making a mistake at work is disappointing, not a catastrophe," to herself when a challenge arises, to try to overcome her fears about failure. Finally, a biopsychosocial perspective sees lots of interconnected reasons for psychological disorders. They can be partly biological and partly learned or based on a person's culture and environment. So Edith's treatment might involve a combination of medication and psychotherapy. Each of these perspectives has strengths and weaknesses, but with all of these different perspectives, mental health professionals have more ways to understand and treat disorders, and research is ongoing. Every time someone makes a mental health breakthrough, the field gains more understanding of what treatments work and how to approach psychological disorders. Human behavior is complex and varied, based on many different factors like individual personality and the culture someone grew up in. And there may be many reasons for maladaptive behavior, from biology to childhood experiences. Mental health professionals need to take all this into account when considering diagnoses and options for treatment, because in the end, we'd all like to feel comfortable, or at least okay. And there's a huge spectrum of what is considered healthy and adaptive. But if you ever feel like you've moved outside of that spectrum, there are professionals with a huge body of research that can help. If you're enjoying Study Hall, Intro to Psychology, and are interested in taking an online course and earning college credit, go to gostudyhall.com or click on this button to learn more. Thanks for watching. See you next time.